What is Parkinson's disease? Parkinson's is a very common neurodegenerative disease that heavily impacts many in America. Approximately 1 million in America, according to scientists, and yet it remains to be uncured, making life incredibly hard to live for patients who have it and their families. The most notable example of the pain felt by most Parkinson's patients comes in the form of tremors, which are basically just uncontrollable jerks and twitches that make it almost impossible for many of these Parkinson's patients to do motor functions without some form of issue. However, there's so many treatments that can effectively be used to help these people and alleviate some of these symptoms, and some of them have some very interesting mechanics behind how they actually function. Obviously, one that most people might see or know about is the use of some drugs and medicines. The most common and popular one for treating tremors is known as levodopa, which effectively helps by entering the brain and replacing the missing dopamine. Intermission here. The main characteristic of Parkinson's is a lack of dopamine, which is a bit strange at first because it seems like that would pertain to depression, since most people associate dopamine with pleasure and the reward hormone. However, dopamine serves as a very important inhibitor. What is an inhibitor, you might be asking? And basically is the opposite of excitatory neurons. So while excitatory neurons may enable motion and excite the other neurons around them to help enable motions and actions, inhibitory neurons are meant to stop it. This is a pretty vast oversimplification, by the way, but it helps to explain this analogy, so you should stay with me here. Basically, the entire point of having tremors can be assumed to be because of these lack of inhibitors in the muscles, which leads to constant movement and shakiness. It's basically like connecting a power supply to a light bulb, but then forgetting to turn off the power supply once the light bulb starts overheating, which causes it to explode. Anyways, back to levodopa. Also, dopa is in the name, so that's kind of neat. Basically, to fulfill the missing dopamine in the brain, levodopa crosses the BBB, or the blood-brain barrier, which basically is a thing preventing our brain from taking in molecules it does not want. Then after levodopa crosses the barrier, it gets converted into dopamine by some interesting process. I think it gets decarbylized or something like that. But once it does do that, that dopamine gets into our brain and fills in for the lack that those missing the patients don't have at all. Now, this normally helps with tremors because it basically acts as the inhibitors that they need, but there are also cases that they don't always work. So if levodopa doesn't always work, what else can we do? Well, there is surgery, of course, but there are certain types of surgeries that work out. One of the coolest surgeries that I actually find fascinating, especially the way it works, is known as deep brain stimulation, or very creatively DBS for short. It's a surgery that involves putting two electrodes on one or both sides of the brain, which will help in controlling movement. And of course, like most brain surgeries, you remain awake to answer questions and basically convey that the doctors have not, in fact, took out a part of your brain that helps you speak or something. After that, you get hooked up to a battery that's placed somewhere near your collarbone. This is called the neurostimulator, because stimulates the neurons. And that battery will send signals to the electrodes, which will send electrical impulses in your brain. In case you did not know, neurons send electrical signals. There's actually chemical signals in the beginning. Then while it travels down, what happens is it releases electrical signals in active charge and because of ionization. But ignore all that. That's not important right now. Basically having these signals will help with regulating the abnormal signaling that's coming in your brain by these neurons, like the excitatory neurons that keep on going, or the inhibitory neurons that just don't do anything. Obviously, because it's a surgery, there are still potential issues that come with DBS. For example, it does increase your risk to like infection or other sicknesses. And because it does send signals into your brain, it can affect some other parts of your functions like speaking or memory, which is a big no-no sometimes. So that's why it's kind of not recommended for everyone. And for people who do want it, the process to verify that they can get it in a way that's not going to like lobotomize them. It's very extensive and methodical. Another type of surgery that's commonly done is known as forced ultrasound surgery, which is basically like the big guns of Parkinson's disease treatments, only because of how it works, because it's a bit extreme on the sides. It's often not the one people want, even though it's pretty effective, but you'll see why. Basically, the entire point of forced ultrasound surgery is that it involves destroying parts of your brain that are causing these constant movements because, after all, your brain technically relegates most of its functions into certain areas. So if you just destroy the areas that are causing these tremors, by logic, it should theoretically cause it to stop, which it actually does most of the time. But here's the issue. It can only be done on one side of the brain. The reason for this, I believe, is that there's a lot of safety concerns. If you do both sides of the brain, you are heavily under risk of damaging functions that you really want to keep. So that's why they don't do it on both sides. Even though there actually is some research that it's possible that we might be seeing these forced ultrasound surgeries on multiple sides of the brain. I say multiple, just two sides of the brain. And the reason being, as I said, it actually affects memory, speech, and swallowing, two of which you really need. Speech, maybe not so much, but I believe most people want to be able to communicate. Another con of forced ultrasound surgery is that it's irreversible, which is, I mean, yes, you're destroying parts of your brain, so kind of expected. But in comparison to DBS, which you can actually shut off, I don't know why you'd want to do that. This, unless there's obviously health or safety concerns, but theoretically, if you are taking DBS, you'd want to like keep it on so that you can disrupt your signaling. There are cases, obviously, where if you're like something happening to your brain, you want to shut it down. But regardless, I'm getting off tangent. But unlike DBS, it's very irreversible. You cannot turn it off. There's no fixing it. Those are the big three treatments, basically, of Parkinson's that we have at the moment. One of which is the one, Levodopa is the one almost everyone uses, by the way. The other two are like extensions if Levodopa do not work. In conclusion, while Parkinson's is a very big problem and definitely has a heavy impact in the lives of patients who have it, while research is being made into the field, we find ourselves getting closer to fully treating it. With results already showing many are able to operate in their daily lives with some of these treatments without having to worry about tremors or motor dysfunctions. With further research, we may find ourselves one day able to fully treat, if not even cure people of Parkinson's. Though it may be quite a long way till we get there, scientists are pretty confident in our slow journey to achieving that dream and maybe even perfectly curing Parkinson's as a whole.